Right. Right into it. Okay. Welcome everybody online or the handful of people here present at the Oakland County Health Network building. My name is Dylan Foster. I am a counselor and a clinical supervisor at Meridian Health Services in Waterford. Today we're going to talk about Narcan or Naloxone and a little bit about the opioid epidemic across the country. Ooh, I'm nervous today. And how we can use harm reduction in terms of reducing the amount of deaths across the country to opioid overdose. I'm going to start with an introduction to what is an opiate, what caused some of the deaths that we're seeing, some of the things that come into play with the amount of people dying across the country. Start simple with what is an opioid. So opioids are a class of drugs that include both prescription pain relievers and illegal drugs such as heroin. They work by attaching to specific receptors in the brain, spinal cord, and other parts of the body, blocking pain signals and reducing feelings of discomfort. They also produce a sense of euphoria or high, which can lead to addiction with prolonged use. Common prescription opiates include oxycodone, hydrocodone, codeine, morphine, and fentanyl. Illicit opiates, such as heroin and illicitly manufactured fentanyl, have become a major public health issue due to their highly addictive nature and the risk of overdose. Ooh, I need to take a breath. Let me calm down here. So, opioids are used to treat pain. They do a really good job of that. And what they do is they can help people feel relaxed, happy, even when pretty severe pain is happening, often used in acute injuries, or long-term pain such as cancer, terminal illness, and other medical issues. They can have some harmful side effects, including drowsiness, confusion, nausea, constipation, euphoria, slowed breathing, and the one that we're here to talk about, which is addiction. Long-term opioid use can have several negative effects on functioning. And then opioid misuse can cause slowed breathing, which can cause hypoxia, a condition that results when too little oxygen reaches the brain. This is something we're going to talk about and how it relates to overdose. One of the primary functions that causes someone to die in the case of an opioid-related overdose is the lack of oxygen. But even in the case where overdose isn't the result, it can still have impact on the respiratory function with somebody in long-term use. Has short and long-term psychological and neurological effects, including coma, permanent brain damage, or death. Research is still ongoing, investigating the long-term effects of opioid addiction on the brain, including whether damage caused by long-term opiate use can be reversed. There's a number of studies showing that other treatment modalities for pain are more effective in the long term than opiates, and it's possible that those type of treatments should be used, especially if we're talking about a long-term illness or pain issue, whereas opiates are more effective in the acute sense where we're taking it over a very short period of time. Commonly used opiates, including, I guess this one has an effect on it, prescription opiates, oxycodone, also known as Oxycontin or Percocet. Percocet is the one that has Tylenol included along with the oxycodone. Fentanyl, which we'll talk about a little bit more in depth in a second. Codeine, hydrocodone or Vicodin, also called Norco. Morphine, hydromorphone or Opana, and then illicit opiates, which include heroin and illicitly manufactured fentanyl, which I want to talk about a little bit more in depth right now. So an illicitly manufactured fentanyl is a synthetic opiate that is up to 50 times stronger than heroin and 100 times stronger than morphine. And one of the biggest factors in the huge increase in overdose deaths in the United States and across the world is this illicitly manufactured fentanyl, which is just as potent or sometimes even more so than the pharmaceutical grade, but there's no regulation. There's no FDA ensuring that this is being produced in a safe manner, that the doses are being given in a way that is appropriate, and it's being mixed with substances or in situations where the person doesn't know what they're getting necessarily. Its potency can change depending on the batch. It's a major contributor to the fatal and non-fatal overdoses in the United States. One of the most dangerous things about it is the fact I mentioned before, it doesn't always come to you sold as fentanyl itself. So the pill that is shown down at the bottom there is it looks and feels just like an Roxycontin, which is supposed to be 30 milligrams of oxycodone. However, this one is a legally produced fentanyl pressed into a pill form that's supposed to look like that oxycodone. So somebody taking that pill isn't going to know that what they're taking is actually 50 to 100 times more potent than what they thought they were getting. It also implies that this is something that was created with FDA approval, given that it has the stamp, looks like a pill, but in fact it was made illegally and without regulation. It's also getting mixed with substances that normally you wouldn't consider to be the same as an opiate, the same effect. So somebody who's thinks they're buying cocaine, which is an upper.
Everybody online, if you could please mute your microphones. Thank you.
Thank you. So somebody who's buying cocaine, which is a stimulant or what we would call an upper, they're not expecting there to be a opiate mixed with that. They might not be somebody who uses opiates regularly. And this IMF is incredibly dangerous when it's used by a person who does not have an opioid tolerance. Tolerance is something that's built up over the course of use over a long period of time. Tolerance goes up, meaning your dose has to go up in order to achieve the same effect. Without that, that tolerance built up overdose risk goes up significantly. So if I've never taken an opioid before and I'm buying what I think is cocaine or meth, which obviously isn't something that is FDA approved itself, but if I'm not expecting there to be an opioid there and I don't have a tolerance, my risk for overdose goes up significantly. It's being mixed with just about everything in a very, very small amount in terms of physical amount is needed for an overdose with fentanyl. So even a very small amount, even accidental exposure or cross-contamination can cause somebody to die. And especially, again, if the person doesn't have an overdose or doesn't have tolerance or doesn't have experience with opioids. So since 1999, overdose deaths related to opiates in the United States have quintupled. So 5 times more deaths since 1999. The mid-90s was, in a lot of research, is shown as the beginning of what is referred to as the opioid epidemic. And one of the causes for that was the pharmaceutical drug called OxyContin, which was created by Purdue and pushed on a lot of doctors to prescribe. It was supposed to be non-addictive. It was supposed to have a lot of positives in terms of what we expect with opioid. We've been aware of addiction risk and the dangers associated with opiates for a long time. However, OxyContin was supposed to be something that reversed some of that. It didn't have some of those qualities. It wasn't as harmful, it wasn't as deadly, or it wasn't as addictive. And it was prescribed in very significant amounts. At one point in the state of Michigan, there was 1.1 opioid prescriptions per one person, which has been just about cut in half today. In Genesee County, which was the highest rate of prescription level in the state of Michigan, had 1.4 prescriptions for opiates written over the course of 1 year for every one person. So for every one person, there was almost 1.5 prescriptions of opioids that were written by a doctor. Many of them were OxyContin, many of them other maybe less potent opioids, but regardless, creates a problem for a lot of people, become reliant on this medication that is highly addictive, and maybe they aren't being told of some of the dangers or made fully aware of the risk involved in taking that long term. So opioid-involved deaths increased by 38%, prescription opioid-involved deaths increased by 17%, and heroin-involved death rates decreased by 7%. Synthetic opioid-involved related deaths, so this would include the fentanyl and other synthetically created opioids, increased by 56% over the course of this time period. What causes an opioid overdose is the part of the brain that regulates breathing is shut down, completely stopped altogether, and that causes the person to stop breathing. The three categories that signal an overdose is happening are pinpoint pupils, unconsciousness, and difficulty breathing. So these are some things that would be telltale sign that somebody might be overdosing. And I'll get into a little bit more detail about what those signs would be, what those would look like in the future when we talk about how to reverse an overdose. So risk factors for overdose. Now this is talking generally, not just people who tend to struggle with heroin use or other opiates, but in general. So a history of opioid use disorder is a risk factor. Somebody who has a history of struggling with that and they go to the doctor for some kind of a pain or a condition, and they are prescribed an opiate, that person is at a greater risk for overdose. Using opioids via injection increases risk. So with bioavailability, which is the amount of a substance that is absorbed based on the way that you take it, is significantly increased when using needles or injecting the opiate. I believe it's something around 99% of the substance is absorbed when we use intravenously versus something like snorting, which is somewhere in the 50 to 60% range. Not that that means it's completely safe to snort the drugs instead of shooting up. However, it does go up significantly when needles come into play. So tolerance break. I mentioned tolerance a little bit earlier. That tolerance builds up slowly over the course of time using a substance regularly. And as that goes up, the amount the person can safely or reasonably take without experiencing an overdose or symptoms similar to an overdose, the amount they can take goes up. If somebody stops taking a substance for whatever reason, maybe they go to treatment, they go to rehab for 30 days, or for some other reason they stop taking it, and then they suffer a relapse or continue to take the same dose that they took before, all of a sudden now that dose or that amount is enough to cause an overdose in that person. So that's especially something to pay attention to at a treatment facility, knowing that relapse rates are high. Oftentimes people return to use immediately following discharge from a residential treatment facility. So keeping in mind that the risk and the danger involved in returning to that use is something that clients should be made aware of, and practitioners should be paying attention to as well. Another increased risk factor is using alone. That especially comes into play with what we're talking about today, which is Narcan or Naloxone, which can help reverse an overdose. If nobody's there to give you Narcan, there's nobody to help you come back if you do fall out. Mixing substances, especially includes benzodiazepines, Ativan, Xanax, Klonopin, and Valium are the big four of those that are prescribed. Using those, alcohol, or really any other substance alongside opiates does increase the risk factor significantly. And then those that have pre-existing medical conditions. So especially things related to breathing, respiratory illness, asthma, COPD, lung disease, anything that might affect the breathing, because what happens in an overdose again is you stop breathing. The brain tells itself to stop the lungs. Therefore, those kind of factors would increase your risk for overdose if you're taking opiates and have lung disease. Okay. It's just some statistics showing the increase in deaths. It first starts out with an increase in prescription-related deaths, which makes sense considering we know that the OxyContin getting prescribed in such huge amounts was big early on in this epidemic. That would make sense to be the first thing that increases. After that comes the increase in the heroin deaths increase after that. So what happens in that case? Mid to late 90s, opioids are being prescribed in huge amounts, at 1.5 prescriptions per one person across the country in some areas. And then all of a sudden, the deaths related to those prescription opioids increases. And so there's got to be a push to stop that. There's a lot of regulation, how much opiates can be prescribed. Doctors have a lot of limits in terms of what they can prescribe, the amounts or the dose. So a lot of people who became dependent or addicted to these medications for their pain were cut off. And when they were cut off, that you're still addicted at that point. And without safe options or without other means to deal with pain, those people often would resort to heroin. And then the end, starting with that purple box there, is related to the synthetic opioids, mainly IMF or illegally manufactured fentanyl, which has caused, as you can see there, a significant jump in the amount of deaths. Again, it's quintupled since 1999. And then the statistic there, 187 people die every day in this country from opioid overdose. So that brings us to the next point, which is what is naloxone, and that's kind of really what I'm here to talk about. Brand name is Narcan. You have a picture there. So naloxone is a medication that can rapidly reverse an opioid overdose. It is a universal opioid antagonist, and what it does is it goes into those receptors, the opioid receptors in the brain, kicks out anything that is currently attached to those, and fills those receptors with naloxone rather than whatever opioid was there. Acts as an antidote effective against oxycodone, fentanyl, Vicodin, heroin, or any other opioid. In some cases, it might take significantly more than just the 1 or 2 doses, especially with fentanyl, as it's a stronger binding agent to those receptors. That Narcan has to work a little bit harder. Sometimes we need more doses for something like fentanyl, but it does work with all of those. First entered the medical field in the 1950s. Most commonly these days, it is you'll see it in a intranasal spray, but there's also versions of it that are an intramuscular injection, and it has saved nearly 30,000 lives to date, and that number probably continues to go up. I don't have stats on that, but it's getting into more and more hands. And things like right now where we're talking about this, more and more people are aware and getting these things into their hands. So there's some legal things, legal considerations when talking about Narcan or naloxone. In Michigan specifically, there is a standing order that states that anyone who is interested in receiving a Narcan kit from a pharmacy, or even from something like a vending machine, which gives out naloxone for free for anybody who happens to walk by. There is no need for a prescription from a doctor. There's no need for no background check, nothing, in order to get a Narcan kit. And this standing order comes from the state. Also, one of the biggest concerns facing fighting against overdose is the fact that we're dealing with something that most of the time is an illegal substance. So what happens often is people are using illegal substances, and somebody within the party starts to fall out, starts to overdose. In the past, I think somebody was lucky if they got dropped off in front of a hospital at the emergency room. Oftentimes just left alone, or maybe hidden behind a dumpster or something even more grotesque than that. And obviously that didn't lead to a lot of people getting the help they need when they're experiencing something like an overdose. So the Good Samaritan laws in place in the state of Michigan protect those who are trying to save somebody's life, call the authorities, call medical professionals in the case of an overdose. And it prevents those people and anybody involved there from being charged with possession of the substance. There's a couple exceptions to that. The exceptions are that it can't be more than what would be considered a personal use amount, and it cannot be, it is specific to the possession of the substance that the person is overdosing on. One more, I didn't have it on this slide, one more legal concern related to it, related to the use of Narcan is, I'm not a doctor, and I know a lot of people that are watching or here present aren't doctors themselves. And normally we couldn't give somebody medication without their consent, without them knowing. So that kind of would prevent me from giving somebody Narcan, potentially risk getting sued. Maybe I gave it to them and they had a negative side effect or something happened. So in order to protect people and make them feel safe to give somebody Narcan, there is a criminal exemption in the state of Michigan stating that a person that administers an opioid antagonist, which Narcan or Naloxone is one, as long as the person truly believes that they are potentially saving the life of somebody who's overdosing, meaning if you're walking, talking, standing right next to me and everything is fine, I can't just for fun spray in the nose with a Narcan kit. I got to have a reason to believe you're overdosing. So as long as in good faith I'm trying to save somebody's life, I'm exempt from any criminal prosecution or sanction under a professional license for using that Narcan to attempt to save that person's life, which is a good practice to have in place because we don't want people feeling like they're scared to give somebody Narcan, feel like they might have some negative side effects, and they don't want to have any concern with getting in trouble for trying to save somebody's life. I think that's it for the legal. Okay, so medication instructions. I'm cruising too fast. So the recommendation from Narcan is to have 2 doses with you at all times. So these, is the camera on me? Okay, so if I hold this in front of me. Okay, so the one single kit of Narcan comes with 2 doses. And it looks like this. You want to have 2 on you at all times per the recommendation from the company itself. What can happen is medications have a thing called half-life, which is how long the substance stays active in the system. Naloxone has a half-life that lasts about 30 to 90 minutes. There's several opiates that have a longer half-life than that. So the duration that they are active inside the body, inside the brain, is longer than that of Narcan. So if you immediately take a substance which causes you to overdose, and let's say that substance stays active for 2 hours in the system, I give you Narcan, you come back. Once the Narcan is cleared out 90 minutes later, those receptors can then be reflooded as that substance is still active, whereas the Narcan is not. So that overdose can reoccur and happen all over again, even though we already gave that person Narcan. So having a second dose is always recommended. Also, anytime we're giving Narcan, we're always going to be calling 911, calling the authorities and getting them to the hospital, regardless of whether or not we have Narcan, regardless of whether or not they come back. There's a lot of negative effects that can come from having an overdose, from potentially not breathing for minutes, is something that needs to have follow-up care from a medical professional. So even if you have 1 million doses, we're still going to do that. The kits should be stored at room temperature, so not too hot, not too cold. If it freezes, which it doesn't freeze at 32 degrees, it freezes at 5 degrees. So, but even then, it shouldn't be stored at that cold of temperatures. If it does freeze, it then becomes no longer effective, and it can be thrown away and replaced at that time. If you use a naloxone nasal spray or your nasal spray expires, contact your provider, contact the pharmacy. As soon as possible, get a replacement. You should probably, if you have a kit, even if you don't, you should replace before it expires. I've heard and I was told that there is no danger associated with giving somebody Narcan or using Narcan after the expiration date. It doesn't cause harm. However, it does lose potency. So it's still, if you have a kit and it's expired and somebody you see or somebody's with you is overdosing, you're not going to harm them by still giving them that Narcan kit. It's definitely better than nothing. But good practice is to make sure that we're replacing these before the expiration date. And it's made easy enough to do so. Any pharmacy will trade them out. Talk to your doctor if you'd rather go that route. And lastly, throw away any used Suboxone nasal spray device and keep that away from children. Although it's not known to be harmful to children, it's relatively safe. Only side effects you're going to see are when somebody has taken opiates or has opiates active in their system. Each one of these little nasal spray things is 1 dose. It immediately delivers all 4 milligrams of the substance all at once into the person's nostril. And so each kit, again, comes with 2 doses, which most of the time we're going to use both doses in the case of an overdose. How do you know if somebody is overdosing? Again, what we notice is somebody's going to be generally unconscious. They're going to have trouble breathing. Some signs that those things are happening are their lips or fingernails are turning blue or purple. The person is going to feel, they're going to look pale, or their skin might feel clammy. Their body is limp. They're possibly vomiting. Foaming at the mouth is another thing. Gurgling noises, or hearing a death rattle, which is sort of a raspy breath that is a signal that somebody is dying or their breathing is starting to stop. Somebody is breathing slowly. Their heart rate might be reduced. And most importantly, they're probably going to be unresponsive. And it can happen very quickly. So you might be sitting next to somebody, talking to them, everything seems okay, and then next thing you know, they're not, they're unresponsive. And at that point, the death can happen very quickly. So how to reverse the opioid overdose using naloxone nasal spray. Start with the overall steps. Step number 1 is you're going to check for a response. So if somebody is non-responsive, they aren't speaking anymore, the first thing to do is try to get their attention. If you know their name, you're going to say their name. You're going to try to clap, maybe in front of their face, see if that does anything. If not, a really good way to check is sternal rub, which is taking your knuckles, pressing on their chest, and rubbing up and down on the sternum, which will wake somebody up if they're not just passed out. If they don't respond, we're going to give naloxone and call 911. Step 3, begin immediately administering rescue breathing and or chest compressions. Step 4, consider giving a second dose. And step 5, assuming the person is back, they're responsive again, or maybe we're out of doses, we're going to put them in the recovery position. So I'm going to go in a little bit deeper into each one of these. And how does, if I have my dummy here, can they see me still? Should be able to, okay. So on the dummy, we're going to take a look at how to safely give somebody Narcan. Can you stand up like that? So step one, check for response. Again, sternal rub, knuckles firmly on the person's sternum, rubbing up and down. If they don't wake up from that, odds are something else is going on. They're not just passed out. They're not just sleeping. It's definitely at that point worth taking the next step. So the very next thing we're going to do, first thing, give them Narcan. Again, this is the very simple, easiest thing in the world to be able to give somebody. There's not a whole lot of mystery when you look at it. You know it's a nasal spray. There's a thing that looks like it's perfect for going inside a nose right there. And so what you're going to do, you can choose either nostril. It really doesn't matter. You can maybe be a person that always goes with the right one. You can be a person that always goes with the left, or maybe you want to mix it up. That's up to you. But the first thing you're going to do is put this part right here, the nozzle, into the nose, and then we're going to press this button, this red plunger here, all the way, and that immediately releases all the substance all at one time. There is no need to prime the pump. There's no need to take any other steps before that. If you try to do that, you're going to spray it all over the place, and none of it's going to get in their nose at that point, so it's not going to do any good. So we're going to administer Narcan into the person's nostril, and then we're going to call 911. Best way to make sure that 911 is called is to do it yourself, or to find another party who might be there and specifically mention to that person to call 911. We're going to give the person on the other line the address where we are. We're going to tell the person that they're non-responsive, they're not breathing, potentially that they're overdosing, and then we're going to begin the next step. Oh, I already covered all this. So after we've given Narcan and called 911, we're going to make sure nothing is in the person's mouth, and we're going to potentially use gloves if you have them. So real quick, I want to talk about a Narcan kit, something that you can put together, or in some cases, you'll be given a kit that has all the things you might need. In order to safely make sure there's nothing in somebody's mouth, the best way to do that is to use your hand. And if you have gloves, that makes sure it's safest for everybody involved. Nothing from my hand is getting in that person's mouth, and nothing in that person's mouth is getting onto my hand. So if you have a kit like this, I'll go over a few things that are good to have in it. First thing being a set of gloves. So I'm going to check the person's mouth and make sure nothing's there. So I got to make sure they're not just choking. I got to make sure there's not something else that's preventing them from being able to breathe. This is less relevant if I know for a fact the person is overdosing. I watch them take the drug, or I know that this is somebody who uses opiates. But still, even in that case, there can be vomiting. There can be other things at play. If they're eating while under the influence of opiates, that can cause choking risk to go up. So it's still something we want to make sure that there's nothing in there blocking. Again, if the overdose is witnessed, meaning we know that this is an opiate overdose, they're not choking on a hot dog, they're not just fainting or whatever, because I watched them take the substance, then we're going to start rescue breathing. If the collapse is unwitnessed, or if somebody, I walk down the street, I see somebody who is non-responsive on the sidewalk, in that case, I'm going to do both chest compressions and rescue breathing. The reason for that is because if I know it's an overdose, I know that what's the biggest risk is that person's going to stop breathing, and they're going to stop getting oxygen to the brain, to the other organs, and that's going to be the thing that kills them. Best practice, if I don't know for a fact that this is an overdose, then chest compressions are going to be potentially helpful in saving that person's life. The reason why, if we don't necessarily need to do chest compressions, because they can cause injury, can be done incorrectly, and again, with overdose, the biggest problem is the lack of breathing and the lack of oxygen. So if we know that it's an overdose, we really want to focus on the breathing and making sure the lungs are getting filled with oxygen. So rescue breathing. The next thing in my kit that I would encourage people to be able to put together is a face shield. So everybody's familiar with masks that we've been wearing for years for COVID. This works very similarly, except you're not going to be putting it on yourself. You're going to put it on this poor person laying down here. The way that the mask is going to go on, the way you make sure that you're putting it on correctly, is you want to be able to read it. So I'm not sure how well this would work, but the words here, if they're legible to me, they're going the right way for me, that's the way that it goes up. So I'm going to put this around my guy's ears, just like the COVID mask that we all love. This respirator is going to go right over their mouth, and that's obviously where I'm going to be placing my own mouth to deliver the breath. Obviously, this does a lot to protect transfer of germs, transfer of any diseases that might be present there. So, again, this is something you might want to include in your kit along with gloves to make sure that when you do, if you do have to use your kit, that you're doing so safely. So, if you have the face shield, you're going to use it. If you don't, you still got to do the rescue breathing, even if it feels like it might be icky or you don't really want to do that. Maybe it's somebody you don't like all that much, but still, we're going to do it. And so we're going to tilt the person's head back after we got our shield on safely with the respirator over the mouth. We're going to lift their chin to open the airways up, pinch their nose, and deliver one strong breath every 5 seconds directly into the person's mouth. If we have a mask, through the respirator, if not, directly into that person's mouth. And you know you're doing it and you know it's working if their chest rises up with every breath. I'm not going to go as far as doing it with my guy here, but you will see the chest go up if you're breathing correctly. So chest compressions. Let me take the mask off the guy. Chest compressions, we're going to put the heel of one hand over the center of the person's chest between the nipples. We're going to put the other hand over top of that, keeping elbows straight with the shoulders directly above the hands. So this is going to look like this. We're going to compress into the person's chest straight down. We should feel it go down at least 2 inches. It's going to be 100 compressions per minute. And then as we're doing the chest compressions and we're watching this person's chest go down at least 2 inches, we're also going to continue to give the rescue breathing. 2 breaths every 30 compressions, because that's, again, very important with opioid-related overdose, is getting the oxygen back into the system. So the rescue breathing is something we're going to do either way. Chest compressions are something we're only going to do if we don't know for sure that this is an opioid overdose. Okay. So after we've done that, we're going to potentially give our second dose. In most cases, regardless, no matter what, it's good to just give the second dose no matter what's happening. If the person doesn't start breathing immediately, obviously we're going to give them another dose, and that doesn't stop with just 2. If you have more with you, you're going to continue to give doses as long as the person isn't breathing. Hopefully before too long, before you run out of doses, the ambulance or the authorities have arrived to help out and take over from there. They should have essentially unlimited doses. I've heard as many as 13 doses of Narcan in order to bring somebody back, which is not all that uncommon with when we're talking about fentanyl, which again is extremely potent, extremely powerful, so it takes extra of the good stuff to be able to kick it out of there. If the person starts breathing after the first dose, a second dose may be needed within 30 to 90 minutes if they stop breathing again. But again, you may as well give them the second dose regardless. But again, authorities will be taking them from there. We're always going to allow them to go to the hospital. We're not doctors, and negative stuff can happen, even if they're back, even if they're talking to you. Something to be aware of. While there are no side effects with naloxone in general, if I were to give myself a dose right now, odds are nothing would happen. I would be just fine. That's not true if somebody actually needs it. If somebody is on opiates, especially if they're overdosing, it can put the person into what's called precipitated withdrawal. And that is all of the withdrawal symptoms that we associate with opioids all at one time, basically. So oftentimes, the person who has been brought back, despite the fact that you just saved their life, they might not appreciate that in the moment, may not understand that in that moment, and they might be not so happy with you as they feel like crap. They were just feeling fantastic just a few minutes before. It really isn't uncommon to hear people wanting to fight after coming back from essentially death, because again, it does not feel good, and this is somebody who is probably having a great time 5 minutes, 10 minutes before this. Keep that in mind, but regardless, I think I'd let somebody punch me if it meant that I was saving their life. Hopefully they, sooner rather than later, appreciate the fact that they were just about to die, but that is something to definitely be aware of. Symptoms of opioid withdrawal include diarrhea, restlessness, elevated anxiety, headache, and a number of others, and these are all things that can start happening immediately, which is, again, another reason why it's important that we make sure that people get medical attention immediately after an overdose. All right. Also, don't leave the person. Don't spray Narcan in the nose and run off. Hang out with them. Make sure that you're there until medical staff arrive, until the police arrive, whoever it might be. Make sure that you're with them. Again, that's why there's these laws in place to protect you from getting charged with possession by the police when they show up. These laws are there to make sure that people's lives are saved, and we're not just dumping them off or hiding them behind a dumpster and leaving them to die. So hang out with them until the ambulance gets there or the police or whoever's coming next. After they are breathing but they remain unresponsive, if that does happen, a lot of times they do just come back fully pretty quickly. But in the case where breathing returns, maybe you're all out of kits, the ambulance hasn't arrived yet, you're going to put the person onto their side into the recovery position, which there's a diagram there to show it, but the person's going to go on their side with one leg. Let's see if I got this thing. It doesn't work on the TV. So one leg out to prevent them from rolling over if they were to roll over by mistake and roll over on their stomach. We don't want them on their back in case they do vomit, which can cause choking. So the recovery position in the case where they're not responsive but breathing after we've given a dose. 5 common places for overdose to occur, or the 5 most common places overdose occurs. Motels. I don't know how I decided which ones were going to have the little animation, but public parking lots, public bathrooms, bus stations are common, and in people's home, which that's going to be the case where you're with somebody, you know somebody, you love somebody who might have an opiate problem, maybe you're using with them. In those cases, it's really important that we're not using alone, or that you have somebody at least who's aware of the fact that you are using opiates and have Narcan handy. If you're by yourself, there's nobody there to give it to you. So a few myths associated with overdose prevention. You should put the person in an ice bath or a cold shower. What this does is it increases risk that somebody's put into shock. It doesn't necessarily reverse overdose. In giving this lecture, this talk about naloxone to clients at Meridian, I've heard all kinds of stories as far as how people have brought somebody back from overdose in the past, whether it's slapping them in the face, punching them, putting them in ice bath, putting ice in places you don't want ice on your body, and then somehow they come back. But there's no evidence to show that these things help, and in fact can harm in the case of an overdose. If you don't have any Narcan with you, the best thing you can do is immediately call 911 and get somebody who does have Narcan. So another one, very similar to that one. It's not. The myth is that it's effective to shake or slap somebody to try to get them to wake up. Again, it doesn't work. The only effective way to reverse an overdose when it's already happening is to give them Narcan. Another myth, overdose is only possible when using needles. I mentioned earlier that overdose risk goes up when using needles as the bioavailability of the substance goes up significantly when you're injecting it directly into the bloodstream. However, 60%, which is about the bioavailability of snorting something like fentanyl or heroin, is still significant when we're talking about something as potent as fentanyl or heroin. So it's absolutely a myth to say that I can't overdose if I'm only taking pills, for example. If I'm only snorting heroin and I know for a fact it's not fentanyl. You don't know for a fact it's not fentanyl, and even if it is pure heroin, which doesn't exist so much anymore, you can still die. However you take it, the risk only goes up with needles, not away. Another myth is that you should induce vomiting. That's not going to help. So don't do that. It can only cause issues in the long run. Top 5 counties in Michigan for overdoses. Wayne County, which consists of Detroit, or the big cities are Detroit, Livonia, Westland, Hamtramck. Macomb County, number 2, which consists of cities like Warren, East Point, Roseville, and Mount Clemens. Third is Genesee, Flint, Mount Morris, Grand Blanc, Burton. Ingham County comes next. Lansing, East Lansing, Holt, and Okemos. And Washtenaw County, Ann Arbor, Ypsilanti, Saline, and Dexter. So that's for that portion of the presentation. One of the things I wanted to do was try to have somebody, a volunteer, come up. There's less people here in person than I thought, to try to see if we can get the steps without having them up in front of us. Is anybody interested? No? You'll do it? All right. So I want to... Yeah. All right, so in order to make sure that you can do it correctly, however you want to do it. You have all the tools.
Am I gonna actually push the button?
If you want to.
I don't wanna waste it.
It's already open.
Oh.
It's up to you. Okay. So this person is unconscious. He doesn't even have arms or legs, but we're going to ignore that part for now. Not responsive. You walk across him. You don't know who he is, what he might have been doing, but this is how you find him.
He's a male, though.
Yeah.
It sounds like. You keep
I think
calling
so.
him him.
Yeah, he's a male, we'll say.
Okay.
So,
Go?
yeah, what's step
my
one?
God.
And explain yourself as you go.
Oh my God. I wanna help him, but I also wanna make sure he's protected and I'm protected too. So I'm gonna put on my gloves. And before I put on this mask, I'm gonna check in his mouth. I don't feel anything. So, I've never done this, so stop me if I'm doing it wrong.
No.
Tilt this little head back here. Maybe I put this on first, actually, I think, before I tilt this back. Oh God, he's dying, and I'm going slowly. Okay. His ears are.
His ears kind of suck.
He has a weird
Yeah.
ears. Okay, now tilt, pinch. Oh wait, was I supposed to give him Narcan at some point first?
That's part of it.
Okay.
Okay. So backtrack, we'll go all the way back to the beginning. We walk up on this guy.
Yeah.
He's not moving, maybe not breathing, or at least
Oh
breathing
yeah,
very
okay,
close.
let's start at the
So,
very beginning.
what do we do?
Sir!
There you go. Okay, so
Sir, are you awake?
step one, let me go back, is to check for a response. There's probably a better way to do this, but step one is to check for a response. And what you did, you yelled their name or you yelled sir, and then I noticed you did the sternal rub. And if you try it on yourself, it doesn't feel very good. It's kind of painful. You'll wake up for sure.
Okay.
Okay, he didn't wake up.
Okay, now I'm gonna check his mouth. When does the Narcan go? Before the mouth check or after the mouth check?
Okay, so step two. So we made
Give
sure he's not awake. So
naloxone,
we're going to
okay.
give naloxone. Well, you're only going to spray it once.
Okay.
Okay.
911. Help, I have somebody at Oakland County Health Network and they're not breathing.
Mm-hmm.
Thank you. I'm gonna do CPR.
Okay.
Now
So
you-
you give him the Narcan, you call 911, that's all of
Yes.
step 2. What is step 3?
Now I check his mouth, right?
Let's see. Yes.
Okay. Now I check his mouth. Okay, and then I put his head back, right?
Yeah.
Yeah, and then, no,
Well, actually.
first I put on my glove,
Mhm,
after I check his,
mhm.
first I put on my glove, then I check his mouth.
Put on your glove. You check his mouth.
Now I'm putting on his face mask
Now,
in a readable direction.
in the readable direction. Now, did you know this person? Did you know what they were doing before?
I didn't, so he's gonna require both chest compressions and mouth blowies.
Blowy.
I've never,
Chest
I don't, I'm from the community, okay?
Okay. So, heel of one hand.
Oh, it starts with that
Mhm.
before blowing in his mouth?
Mhm.
Okay.
And then you're gonna compress the chest down 2 inches. You're gonna do that 100 beats a minute, and then every 30 compression. You don't have to do all 30.
Okay.
But then, so after you do that, let's say you've done it 30
30.
times, and then you're gonna do the rest
Now.
of the breathing. Okay. So the way that looks is very good. Very good. The chest is rising
Right.
every time you
Oh,
breathe.
should I actually do it?
No, you don't have to do that.
Okay.
I don't have the bag in there anyway. So is he coming back or is he not coming back?
He's not coming
He's not coming
back.
back. Okay, so what
Do
do
it
we
again.
do? What do we do next? Yep.
And another Narcan.
Gonna give him another Narcan. And now he comes back.
Oh, okay.
Yay.
Putting
He
him
feels
on his
better.
side,
He's
lifting
breathing
up
again.
his little leg, and his arm like goes under his face or something. I'll take this off so he
Yep.
can breathe.
Wonderful.
Oh, he puked.
He puked, but he's safe because he's not on his back and he's not gonna choke. That's perfect. Very good job. Thank you so much. I'm one of 2 of the 3 available volunteers. Thank you so much.
Oh, do you want me to throw that out?
Thank you so much. All right, so I'm going to reiterate again, just to make sure the steps are hammered home and we know exactly what we're doing to make sure this person makes it through. Again, step 1, check for a response. Give Naloxone and call 911. Can't stress the importance of calling 911. Immediately administer rescue breathing if we know that they're overdosing, and we're going to give chest compressions and rescue breathing if we don't know what's happening. After we've done that for 2 to 3 minutes, we're going to give the second dose, and then once they're back, they're breathing, they seem to be a little bit, doing a little bit better, but maybe they're not back fully yet, we're going to put them into the recovery position so that anything that follows, any vomiting or anything, is going to be not put them at risk for choking. So that's that. Those are the steps for reversing overdose using Narcan. Again, there are other forms of Narcan that are out there. This is the most common. This is the one you're going to find just about anywhere. Just about anybody that's going to give you a naloxone kit. It's going to look like this. It's going to be the Narcan nasal spray. There are some other varieties out there. One being injection, which will have a vial. It'll have needles. It'll also come with 2 doses. Each dose will be in its own vial and have its own needle. In those cases, it's going to be a intramuscular injection. A good place to deliver an intramuscular injection on a person is going to be in the dead center of the arm, near the bicep here, right in the middle of this part of the arm is going to be the best place to do, make sure it gets into the muscle. Those kits are less popular, I guess is the word, now compared to the nasal spray because of how easy the nasal spray is. But if you ever come across a kit that has a needle, it's generally going to be an intramuscular needle. Another version of the spray that's out there is one that is very fancy, and you open it up and push a button and it starts telling you the steps, which is really cool, but I haven't seen any of those in person, but I've heard that those exist. I believe those are also generally in the form of a nasal spray. But maybe those will become popular just to prevent any weirdness that can happen when people don't know what they're doing. But really, there's not a whole lot of risk involved. It's very safe. I mentioned it before. It's not known to be harmful to children. It's not going to have side effects in most cases, unless the person has taken opiates or is overdosing. In those cases, there are the side effects, but we'll take side effects over loss of life any day. Some concerns that I want to touch on and discuss briefly before I finish up are common criticisms associated with Narcan or other harm reduction type treatment modalities. This is something, again, I've delivered this lecture to the clients at Meridian over the course of the past couple years. Always come across at least some version of these criticisms in talking to the clients. And I want to just touch on some of these. So common concern number one, the availability of naloxone will encourage abuse by drug users because they'll be more likely to take larger doses if they know naloxone is available. Just about everybody who uses opiates or uses opiates to the point where they might use a large dose just because they know somebody's got Narcan, almost all of them know that naloxone not only ruins your high, but puts you potentially immediately into withdrawal. It's one of the things that somebody who's actively using opiates is trying to avoid, like the plague in their life. They don't want to experience withdrawal. Studies have shown that the availability of naloxone does not increase the doses used by an opioid user. It doesn't increase the risk that somebody is going to use opiates. Nobody has ever said, you know, I've never used heroin, but now that I heard about this naloxone thing, I'm going to try it. I'm going to go, you know, pick some up and give it a shot because if I die, somebody might be able to bring me back. That's not something that people have said, and at least not to the point where it's something that we got to worry about in terms of talking about Narcan or talking about other ways that can reverse overdose or reduce harm in terms of opiate-related stuff. Common concern number two, drug users and other lay people are not medically trained and will be unable to administer naloxone properly. We just went over the steps. There's not a whole lot of tricks to it. There's not a lot of complications. It's pretty easy to do. If you mess something up, again, this person is somebody who's dying in front of you. So again, any harm that might come from you giving Narcan incorrectly, which the only thing I can think of is maybe you spray it in the ear instead of the nose, which would be a big mistake. But as long as you know it goes in the nose, there's not a whole lot of harm that can happen. And again, there's relatively little side effects. And then again, there's laws in place to protect somebody who is a lay person from feeling afraid or being scared to give somebody Narcan. So there's really no risk in terms of having this in the hands of people. Common concern number three, naloxone will discourage people from seeking drug treatment. This one is not only not true, but kind of has the opposite effect. Studies demonstrate that naloxone program participants may be more likely to access treatment than those that are not made aware of naloxone or have not attended a class like this or a lecture like this. Common concern number four, side effects from naloxone can be a threat to the health and safety of the overdose victim if they are not thereafter treated by medical professionals. We should point out in that case that empirical studies indicate that people who refuse to be taken to the hospital after receiving naloxone generally did not receive any adverse or experience any adverse health effects. So this idea that if drug addicts or people that are struggling with addiction, or even a friend or a coworker, a loved one of somebody who's struggling with addiction, the idea that if I give that to them, I'm not a medical professional, there's not necessarily medical professionals around, the idea that because they don't go to the hospital afterwards, they could have more harm done, it doesn't make any sense to me, because, well, the person, again, was just dying just a few minutes ago. So that concern kind of goes out the window. But we always recommend 911. Always call 911. Always make sure, if you can, to the best of your ability, make sure that the person goes to the hospital. Again, there's all kinds of effects that can happen following an overdose, following periods of time without breathing. Can't stress that point enough. All right. I think that's all I got. Do we have any questions?
We had a few come in throughout. So the first question that came in was, if spray was used post-expiration date, would it be effective or lose potency, et cetera?
Yeah, so I touched on it briefly earlier. It does lose potency, but it does so pretty slowly. It's not as if, like, so this kit right here expires November 2025. It's not as if, you know, on November 1st, this is now useless, right? It takes time. It does lose its effectiveness over the course of about 18 months. The one study or the one statistic that I heard was that up to 18 months following the expiration date, it can still be effective enough to reverse overdose. But again, you want to make sure that you're replacing these kits ahead of time, being proactive, and getting them sooner rather than later if you're nearing the expiration date.
Okay, and then we had another one that said, weird question, but what should you do if there is two people currently experiencing an overdose, opiate overdose together?
And maybe, am I one of the people overdosing, or?
I would say so, yeah.
So,
Okay.
Two people together, yep. Oh,
So if I'm overdosing and you're overdosing.
Oh, sorry.
you can go ahead.
Okay, so I was just saying is that, like, you're in an area and there's two people that are currently overdosing on the opioid, and regarding this, since there's two like applicators for, you know, Narcan, you know, what would be the best, you know, solution or option, you know, going forward? Because it's like, obviously you'll call 911 after you give the next naloxone, but you know, do you give the other one as well, and then hopefully they, you know, ambulance comes in within the 30 to 90 minutes, or?
Okay, so the main question is, do you, like, say you have one box which contains two kits, do you
Yeah.
give one to each person, or
Mhm.
do you give both to one person?
Right.
Okay. In that case, obviously the first thing, you mentioned it yourself, the first thing you do is call 911.
Mhm.
The joke I'm trying to make is you pick who you like more, but I'm not going to make that joke. But you would, I'm not 100% sure what the correct answer to that would be, other than to make sure you call 911 and deliver a dose of Narcan to at least one of those people, if not both, and
Okay.
then hope that the response is quick.
Gotcha. Okay. Yeah, I was just thinking, you know, maybe, but that was pretty much what I was thinking about. I just wasn't sure if it was like another way about going about it. But okay.
Mm-hmm.
Thank you.
Yep. It's a good question. I'm not 100% sure.
And then we have a question that says, where can we get the spray?
Okay, so the spray can be gotten in so many different places. It's readily available at most pharmacies, really any pharmacy, as long as they have it in stock. Again, there's a standing order in the state of Michigan where anybody can get a kit without a prescription from a doctor. There are becoming more and more common Narcan vending machines, which generally are free. We have one at Meridian in our MAP program in Waterford. We have a vending machine there that has Narcan kits available. I believe there's one around Oakland County building here, maybe by the crisis unit. They're everywhere. Coming to lectures or trainings like this, generally one of the things that comes along with it is a Narcan kit will be given at the end. So it's readily available. It can be found. Best place to look for sure is a pharmacy. And regardless of whether or not you have an issue with opiates, regardless of whether or not you have a prescription for opioids, you can always talk to your doctor. And if not hand you one directly, they can definitely write your prescription if you feel better about doing it that way. There's certain cases where you automatically are going to be given a prescription or a kit for Narcan, and that is if you're prescribed high doses of opiates, or if you have an opioid alongside another prescription like the benzodiazepines, which I mentioned earlier, which the combination of those two substances greatly increases the risk of overdose. So in those cases, you got no choice really but to get a kit from your doctor. There's really all kinds of ways to get it. Best bet is to go to your pharmacy and see if they can help you out. It should be covered by your insurance for the most part. It is possible there's a copay associated with it depending on your plan.
Do we have any more questions? You can put them in the chat or you can unmute yourself. In the room, we have a question here.
Thank you, Kaylee. So just thinking back to what you had said earlier, when you were tracing the history of opiate addiction and the rise since 1999, just thinking that with so many starting out as a prescription, what advice might you give to somebody who has been prescribed opiates for the first time and is just wanting to make sure that they are using safely and aware of the risks for overdose?
Great question. The safest and the best way to answer that would be to ensure that you're working closely with your doctor in terms of what this medication is used for, how to use it safely, what kind of dose you're being prescribed, and how to make sure you're not going over. Some other things you can do is make sure that you have somebody you love, somebody that you live with, can make sure that you're not overusing these medications. But the best thing is to make sure you're communicating with your doctor, making sure that there's no other safer or even more effective options for dealing with pain. I mentioned earlier that the best treatments for long-term pain often don't involve opioids at all. Physical therapy and other options, other holistic options might actually be more effective in the long term than opioids. And in fact, opioids have been shown to increase pain. So it's always worth talking to your doctor. What other options do I have? And follow the prescription to a T.
Any more questions in the room? Online? All right, thank you.
All right, thank you.
Wait, we got one more question that just came in. To clarify, the kits are free, or do I have to claim it on my insurance?
Most cases it's free. Like I said, it is possible that you have a copay with your insurance. Depends on what route you go to get it. If you come to like I said, a training like this, it's going to be free. And most of those vending machines, which I mentioned earlier, you can find in various places. Inner city centers is a great place that those things tend to pop up. In those cases, it's going to be free.
And for folks in Oakland County, there's a great organization called the Alliance of Coalitions for Healthy Communities. Basically just has a community coalition for pretty much every major city and township in the county, and they are distributing kits basically every single day and providing similar training. So, I've got their phone number here. Thank you, Sherry. Their phone number is 248-221-7101. And if you or somebody you love needed a kit, they'd be a great resource for folks in Oakland County.
Thank you. All right.
Thank you, Philip. I don't think there's any more questions. Lots of thank
Wonderful.
yous. Great job. So I'm going to put the evaluation barcode up, unless there's any final thoughts. Put it at the end here. I'll also send, the link in the chat. There we go. All right, you can scan the barcode, and then we will have until 12 p.m. tomorrow to complete the evaluation. Certificates should be emailed out between, I want to say, 10 and 14 days. I know some of you online had some questions about the presentation. We can send out the PowerPoint slides as well. And yes, thank you. We'll stay on for a little bit longer if anybody has any additional questions or if we have any troubles with the barcode. And I will send it in the chat right now, the link.